Welcome to Crash Cart Nursing, where we help resuscitate your nursing education one topic at a time. I'm Nick McAllister. I'm a registered nurse specializing in emergency medicine and a professor of nursing. Today, we're kicking off our very first episode in a series about pediatric nursing. We're starting with the foundations and talking about family-centered care, growth and development, and health promotion. These are really the building blocks of working with kids and their families. Understanding these concepts makes all the difference in your nursing practice. But this isn't your standard dry lecture. We're making this fun, relatable, and packed with real-world stories, including today one from my own experience as a parent that changed the way that I think about pediatric nursing forever. All right, let's start with the foundation of pediatric nursing, family-centered care. If you take one thing away from this episode, let it be this. When you're caring for a child, you're caring for the whole family. Parents, guardians, siblings, they're all part of the equation. Now listen, I get it. Sometimes involving families can feel like an extra step in an already busy shift. You've got meds to give, vitals to check, charting piling up, and now you got to slow down and explain everything to a worried parent. But here's the thing. That extra step isn't extra, and it really isn't a courtesy. It's a crucial part of patient care. I want to share a personal experience that really cemented this for me, not just as a nurse, but as a parent. A few years ago, actually not even a few years ago, it's almost over a decade ago, my son Gabe was a patient at Children's Hospital in Boston. We're in the middle of doing a procedure called a sedation holiday. If you're not familiar, that's when we pause sedation to see if a patient can tolerate being off of a breathing tube. If they can tolerate being awake, you can usually wean that ventilator and hopefully get them extubated to where they no longer have that breathing tube. Well, during that process, one of the nurses made this complete unilateral decision that they were going to start the sedation back up. There was no warning, no explanation whatsoever, and absolutely no discussion with me as a parent. So I'm just sitting there in this room with my son watching, hopeful that he's going to come off of sedation, and all of a sudden we're turning it back on. And I wasn't a nurse at the time. And I'm thinking, like, is there a reason? Can you tell me why? Why all of a sudden are we turning this back on? Like, what is the rationale behind it? I wanted to know, even though I wasn't a healthcare provider at the time. She had no answer. She actually refused to talk to me about it. No rationale, no context, just shut the door to communication with me. That decision made this whole cascade of events happen, where we ended up having to call a full care conference just to get back on the same page. And here's the thing. We weren't in an emergent situation. Nothing life-threatening was going on. There was time for conversation. There was time for an explanation. And that would have changed everything about how I, as a parent, felt about that nurse, how I felt about the situation that was going on. You know, the thing is when your kids are in the hospital, you already feel out of control. So here's the truth that I want you to take away. Parents aren't the enemy, okay? In fact, we as parents are your biggest ally. We want the same thing you do, and that's the best possible outcome for our child. So how do we avoid situations like this? How do we make sure that parents feel heard and included? It comes down to a few key things. Number one is partnership. Parents aren't visitors. They're part of our care team. Okay. Number two is respect and cultural sensitivity. Every family has different values, and we have to honor those values even if they fall outside of ours. Communication is the next one. Even a 30-second explanation can build a huge amount of trust. You know, we know what we're doing. Do they know what we're doing? And then empowerment. Parents need to know that they know their child better than we do, and they should be able to advocate for that child, and we should listen to them. So let's take a metaphor break here. So think of family-centered care like a relay race. The child's the baton, and we, the nurses, doctors, therapists, and family, are all part of the same team. If one person fumbles that baton or refuses to pass it, the whole race falls apart. But if we communicate, support each other, and work together, that's how we win. Now, let's talk more about growth and development. Why do milestones matter? Pediatric nursing is all about understanding where kids should be in their developmental journey. Because if we don't know what's normal, how can we spot what's not? Think of it this way. If you're watching a detective movie and the main character suddenly gains superpowers out of nowhere, you'd be confused, right? because that's not normal progression for a detective. The same goes for kids. We have to understand their normal storyline so we can catch red flags early. Now let's break it down by age group. Infants, 0 to 12 months. This is the year of rapid change. Infants change so fast. One day they're helpless little blobs, and before you know it, they're crawling across the room faster than you can react. So let's hit some key milestones. As far as motor function, by 4 to 6 months, they should be rolling over. By 6 to 8 months, they sit up like a pro. By 9 months, they're pulling up to stand, meaning that they're going to be into everything. And by 12 months, many are walking. Cognitively, one word, peekaboo. Around 9 months, babies develop object permanence. They realize things exist even when they can't see them. That is object permanence. That's why peekaboo goes from boring to the most hilarious thing ever. Socially, stranger anxiety. This is totally normal. It starts around 6 to 8 months when babies realize, wait, who is this person and why are they holding me? It's so funny to me that people often get mad because a 6 to 8 month old is like, who are you? And they don't necessarily want to be held by that person. And sometimes people get upset about that. It's funny because it's a totally normal developmental milestone. And we need to understand that it's actually a safety mechanism. Toddlers, ages 1 to 3 years old. This is the know and mind phase. Toddlers, tiny humans with big opinions and no hesitation in expressing them. You ask, do you want to wear the red shirt or the blue shirt? And they scream no to both. Welcome to toddlerhood. Now, from a motor standpoint, they go from waddling around at 1 year to running and jumping by 2 to 3 years old. They can climb, and they will climb. Keep an eye on your furniture. Cognitively, they're egocentric. Everything is about them. Sharing, not going to happen yet. They love routines. Try to change bedtime, and you'll see a full-blown meltdown. Socially, toddlers engage in parallel play, meaning that they play next to another kid, but not really with them. It's like when two people sit at a coffee shop working on laptops in silence. It's playtime, just not interactive. Preschool. This is 3 to 6 years old. These are the magical thinkers. Preschoolers are hilarious because they're deep in magical thinking. They truly believe in Santa, the Tooth Fairy, and that their stuffed bear has feelings. In fact, I remember with my niece one time, she was about 3 or 4 years old, and she had a dollhouse, and she had this little teddy bear. And the teddy bear got a little bit too close to the fireplace that was painted on the wall of this dollhouse. And in an instant, she had that imaginary moment where I just lit this bear's bottom on fire. And she grabbed the bear. The bear was crying. She patted the bear's bottom, got the fire out, did a whole stop, drop, and roll thing. But in my motioning, she went to that. It was so crazy. And it's such a great example of how imaginative play is huge for these kids. Now, socially, this is when cooperative play kicks in. They actually start really playing with each other instead of just next to each other. They develop a narrative in their head of what's going on, and they can track with it and track with each other. It's a really, really fun age. School-age kids. This is our 6 to 12 years old. These kids are rule followers and logic lovers. If you've ever argued with an 8-year-old about fairness, you know that school-age kids love rules. They want everything to be fair and logical. If you give their sibling a sticker, they expect one too, because that's logical. Why would you give one to somebody and not to somebody else? So everything is rooted in that logical thinking. No more magical thinking here, which is kind of a bummer. So cognitively, they move to logic from magic. Now, motor-wise, they refine skills like jumping rope, playing sports, and biking. Now, socially, friends become super important. Peer approval is everything. As we get into adolescence, we're talking 12 to 18 years old, and this is where the identity crisis years happen. Adolescents are a whole different ballgame. 1 minute they want to be independent, the next they need your help. Does that sound familiar? I feel that way sometimes as an adult. Cognitively, they develop abstract thinking, meaning that they can plan for the future, or at least start to. Socially, they go through identity versus role confusion. They're figuring out who they are. And peer influence is huge. Quick case study. Let's talk about a 2-year-old who comes in. The parents say they're not really talking much yet. What's your move? Do we tell them to wait and see? Kids develop at their own pace. Do we suggest a speech therapy referral? Do we ignore it since they're walking? Or do we tell them to wait until the age of 3 before intervening? If you answered suggested speech therapy referral, you're correct, because a 2-year-old should have a 50-plus word vocabulary, and they should start forming 2-word phrases like want cookie. If they're not, a speech evaluation might be needed. It's important that we don't just brush aside things that are abnormal, but this ability to see what is normal, to know what is normal, is very, very helpful, because then we can do interventions on what is abnormal. Okay, let's talk about keeping kids healthy and safe. Pediatric nursing isn't just about treating illness, it's about preventing problems before they start. First off in this list is talking about vaccines, because prevention saves lives. Some of the big ones are MMR, which is measles, mumps, rubella, DTaP, which is diphtheria, tetanus, pertussis, polio, and Hep B. Live vaccines like MMR and varicella are not for immunocompromised kids. So anything that has a live vaccine, anybody who's immunocompromised or actively sick should not be receiving it. So if kids have a fever, they shouldn't be getting immunized. The why behind that is that when we are immunizing somebody, we are causing an immune response to happen. So if their body is already fighting, doing its own immune response, we don't want to add something more to that. Okay. Now, parents will have concerns about vaccines. Instead of dismissing them, we should educate with facts. I hear your concerns. Here's what we know. Here is the data. Okay. That's much better than saying, hey, you're just flat out wrong. Now, one of the best things that I ever heard when I was in nursing school was from a professor that I had. He talked about vaccine safety. And one of the things that he mentioned was, if you look at vaccines as a whole across society, you can say vaccines as a public good are great. They have reduced illness. They have caused child mortality rates to go down. Vaccine preventable illnesses is what we classify them as. But the big thing to take away from this is that although they are good at a public level, but there are always going to be exceptions. There's going to be people who live outside of that. So we shouldn't make everything based on only what is the public good, what is good for the general population. There are going to be outliers. There are going to be people who have allergic reactions. There are going to be people who have moral reasons why they don't want to go with it. There are going to be people who have reasons that are religious. And as nurses, it's not our job to judge all of those things. Our job is to educate and advocate for our patients. And ultimately, we want to advocate for safety. Ultimately, we want to go according to what the guidelines are of the American Academy of Pediatrics and other trusted sources. But we also need to have flexibility and know that it's not up to us to judge somebody for their decision. I want to take this opportunity to tell you that if you have a pediatric patient with a fever alone does not indicate that they have a vaccine preventable illness. It's our responsibility as healthcare providers to do the due diligence and find out, do they in fact have a vaccine preventable illness? Maybe. But just having a fever alone isn't automatic reason for judgment. Let's remember, kids are people who get sick quite often. Their immune system is still being established. They're still growing and developing. And kids are germ factories. So they're going to get sick. They're going to have fevers. If they're not vaccinated, instead of just judging that, we need to make sure that we ask questions. Find out why are they not vaccinated. Find out what happened. Perhaps they have a family member who is disabled from a vaccine injury. You know, a lot of vaccine injuries are widely underreported. In fact, the system that we report vaccine injuries on, I know many healthcare providers who never knew about it, maybe for years. I think COVID really helped shed some light into this side of the industry that, you know, vaccine manufacturers are safe from liability. So if you get vaccine injured, you can't go and sue the vaccine manufacturer. You know, it's kind of interesting because if you have an adverse event with a medication, you can take that and sue the manufacturer of that medication. But vaccines operate a little bit differently because vaccines are protected and vaccine manufacturers are protected. In 1986, Ronald Reagan signed into law the National Childhood Vaccine Injury Act. It was part of a bigger bill, but the point of it was to make it to where vaccine manufacturers were no longer liable for injury claims. And so they created this whole National Vaccine Injury Compensation Program where patients who were victims of vaccine injury, they can go through this whole thing that is handled by the United States Court of Federal Claims and Special Masters. And so we have a reporting system called VAERS, which is the Vaccine Adverse Event Reporting System that we're supposed to report to. And the problem is that sometimes vaccine injuries take quite some time to notice what happened. And so as healthcare providers, it's important that we know what a vaccine injury looks like. We know that they can take time, and then we're responsible to report those as they come up if we see them. The problem is that for most places, when you give an immunization, we're watching them for a few minutes. I mean, it's not long enough for a long-term effect to show itself. And I think that COVID really helped highlight some of the problems with this system, because you had people who were hesitant to get the COVID vaccine because it's the first time in my lifetime, at least, where the government was saying, or employers were saying, like, you need to get this vaccine and pushing it. I think in healthcare, we had mandatory vaccination for many different things. Like there were exemptions, but some were hard to obtain, whatever. And so I think that the world as a whole, people are kind of more open to this idea that, maybe this isn't a chemical that I want in my body, and I should have the right to choose what goes into my body. And I guess I tell you this because I want you to think about this from the patient standpoint, that if you feel like everybody in healthcare is kind of ganging up on you and telling you, you have to do this, that's pretty intimidating. And so it's important that as nurses that we have an open mind, we listen to our patients, we hear what they're saying, hear what their hesitations are. And some of them are simple things where it's like just a lack of education. They don't understand something. Maybe there's not a significant belief there of saying, I don't want this for my child. But it's that what they're really saying is, I have questions and I need my questions answered. I need my fears addressed. And when we can address those fears, that's just such a better place for us to be in as a nurse. And that helps us establish rapport, establish trust. We can show them the evidence-based practice, the evidence-based medicine, and help them get the thing that they need. And for some people, no matter what, it may not be the right thing. There are always going to be those outliers who it's good at a public good level, but it may not be good for them, and that's okay. But we also want to give people the opportunity to live their truth, to live their life based off of what they know and believe is best for them. And circling back to what we talked about at the beginning, that parents are not somebody who's in opposition to your care. They are a huge part of your care team, and we need to embrace what they have to say. Now, let's talk about building healthy habits. So infant nutrition, breastfeeding or iron fortified formula for the first 6 months. Start solids around 6 months, one new food at a time. No honey before the age of 1 because there's a botulism risk, which is a bacteria that can be deadly in newborns. Now, talking about breastfeeding versus iron fortified formula, obviously both can allow kids to survive. I have never met anybody who is having a comparison by the time that they're in kindergarten of who was breastfed and who was bottle fed. So let's just take that off the table. This is not something we need to be judging people about. If mom wasn't able to, didn't want to, whatever the circumstances, as long as they're getting either breastfed or iron fortified formula, they're probably going to be just fine. Now, that being said, breastfeeding is an absolute superpower, and it causes kids to get access to an immune system that is more robust than anything that they have. And I just don't think there's any supplement that's quite ever going to be as good as breastfeeding. I think it's an amazing superpower and something we should definitely encourage. And as a dad, I know I loved it that it was happening for my kids because, for one, it's best for them, and they really do get way better nutrition and antibodies from mom for illnesses that mom's already fought off. The other thing is breastfeeding saves a ton of money. Formula is expensive. So if your patients are struggling, financially, I mean, to me, breastfeeding is a no-brainer, but obviously there's reasons why people don't do it and why they can't do it. So we got to have that open mind. Now let's talk toddler nutrition. Picky eaters are normal here. Okay, so we offer a variety, but don't force it. If your kid wants to eat a string cheese, you let them eat a string cheese, right? We want to limit juice. We want to limit too much sugar because it can lead to cavities and obesity. So whatever things that they will eat, as long as it's somewhat nutritionally sound, that's what we're going for, right? So we just want to make sure that there is some moderation as far as nutrition that they're getting, but it is normal for toddlers to be picky. I know my 3-year-old is in this stage right now where she'll ask for something, not eat it. And I'm like, why did I just make that for you? Injury prevention, because kids are daredevils. Car seats. So the gold standard for this is we want rear facing until at least 2 years old. Car seat safety is huge. We really have to be cognizant of this, be mindful, because kids can have internal decapitation if they're forward facing too young. So it's not just somebody being paranoid. There is documented cases of this happening. And I know me as a parent, I would never want to experience something like this. And sometimes people will say, well, their legs are too long. They can't fit in the car seat. Well, as long as you have an appropriate size seat, they should be able to fit, and their legs bend. Choking hazards. We want to cut foods into small pieces, no whole grapes, hot dogs, or big chunks. Water safety. Drowning is the number one cause of injury and death in kids 1 to 4. Please supervise them near water. We have canals here in Idaho. I think it's so crazy how many people will walk and play near the canals with their kids, and the water is flowing. It's flowing fast, and a kid gets in there and they die. A parent jumps in after them, and often they die too. So please be safe with your kids around water. And then the last thing on injury prevention that I want to talk about is hot cars. We have to be safe about this. This is something as nurses, we need to make sure that we're encouraging people. If you're taking your kiddo with you in the middle of the summer somewhere, or anytime, if you're taking them with you, we got to be checking the back seat, or, especially if you have a sporadic schedule where one day they're with mom, one day they're with dad, one day they're somewhere else. You got to check the back seat, because kids die in hot cars. So, quick quiz. What's the number one cause of death in kids over the age of 1? Infections, congenital diseases, unintentional injuries, or cancer? If you said unintentional injuries, you are correct. Accidents like car crashes, drowning, and falls are the leading cause of death in kids over 1 year old. All right, nurses, that wraps up this episode of Crash Cart Nursing. I'm so glad you came. I hope you found today's discussion helpful as you continue your journey in nursing. Remember, every shift is a chance to learn, grow, and make a difference. So stay curious, stay confident, and most importantly, stay compassionate. If you enjoyed this episode, don't forget to subscribe so you never miss a new one. And if you found this helpful, share it with a classmate or a coworker. Let's build this community together. Until next time, keep your crash cart stocked, your caffeine intake high, and your assessments thorough. See you in the next episode.